Welcome back. Joining us now is Dr. Bruce Ward of the BC Dental Association. Welcome, Bruce.
Thanks.
Our person of the week, Jay Lundy, had an accident in his 20s, knocked out some of his front teeth, had a bridge put in, but now he's done a replacement bridge. Why does he have to do that?
Well, a lot of people think that bridges and crowns are forever. Once they get put in, they never need to be replaced. But the truth is, a lot of things happen in your mouth. One of the things, as we talked about before, is as you grow older, your gums recede, and all of a sudden they've exposed the edges of your bridge or your crown, so you can see them. Sometimes decay happens. People think bridges don't decay. Well, the bridge doesn't decay because it's made of metal, but the tooth underneath the bridge can decay unless you take great care of it. So the bridges fail from time to time, and they have a finite lifespan. Plus, they're only as good as the cement that we put them in with. So there's lots of reasons why, and they usually do need to be replaced. If you can get 20 years out of a bridge, you're doing really well.
Now, the implants are sort of I don't know if they're the next thing or whether it's different than a bridge. Could he have replaced his bridge with an implant as well?
There's a lot of buzz about implants. When I graduated from dental school 30 years ago, implants were kind of on the fringe. They were only being done by a few people, and they didn't have a very good success rate. But in the last 30 years, implants have come along incredibly well, to the point now where they're almost the treatment of choice. So yeah, if you've had a bunch of teeth knocked out, or if you're even missing a single tooth, implants can be considered an option no matter how old you are.
If you've kind of got a few teeth that are out from an accident or whatever, which one are you going to choose? Would you ever say, no, the bridge is still the best way to go? I mean,
there's certain things that determine whether you use an implant or a bridge. Some people can't have implants. They have medical conditions that make the quality of their bone poor, so they can't have an implant. For some people, implants just aren't really an option financially. A bridge is a little more reasonable option from time to time. So there's sometimes that people can't get implants, and in that case, a bridge or a removable partial denture would be the best thing. But there's a lot of talk out there now that basically says implants are kind of the best way to restore a tooth when you're missing that tooth, or teeth when you're missing those teeth.
Now you brought up the cost factor.
Yeah.
That's a big deal then?
Implants can be quite expensive. They run a big range depending on the kind of implant you use and who's placing the implants. But by the time you take the implant and add the costs of putting the new tooth onto it, they can be more expensive than a bridge for sure. Because implants came onto the scene late after a lot of the insurance plans were developed, and a lot of insurance plans don't cover implants, although more and more are beginning to cover implants, or at least looking at covering implants as an option, as a possibility, yeah.
And implants they're developing still, they're changing and evolving too?
It's amazing. It's probably the biggest growth area in dentistry right now. There's so much happening in the area of implants. They're getting better. The way that we restore the implants, put teeth on top of them, is getting better. And the cost is coming down slightly, although the implants themselves are very expensive to manufacture. They're very expensive to manufacture. So when a dentist puts one in, they've got a significant investment in that implant before they even start.
It sounds as though there's a really nice quality of life addition that happens as we age and have to deal with more teeth issues. There's more confidence and just more comfort as well, and longevity in whatever procedure you do get done.
Absolutely. Well, one of the things that implants has really made a huge difference in is people who have dentures. People who have dentures have traditionally had a hard time keeping them in. They come out, they move around, they're difficult to fit. And implants have opened a whole new area of practice for people, because you can put some implants in a mouth in the person who's having problems keeping their denture in, and the denture just snaps into place. So they put it in, snap it in over the implants, and it's like they have their own teeth. It's an amazing technology, and it's a huge difference for people. Yeah.
Well, it's kind of good to know we're going in the right direction with all of that.
Oh yeah. Yes.
Thanks for the info.
Thanks.
We'll be back in a moment.
North of 49, a guide to the rest of your life.